first issue is the one the ministers talked about, and that is the issue of the bed capacity for the facilities. In an effort to curb fraud, which the CS rightfully put that is mostly in private sector, we have found some public facilities also in the crossfire, not necessarily because they have fraud, but because they have not updated their records with the KMPDC on the bed capacity. So our belief is that the records that the ministry is using or she is using to remunerate the facilities on the bed capacity is outdated. Whereas the minister has requested that we update those records now. If you look at the 47 county governments and the facilities are there, it will definitely take a bit of time because we only have one KPDC in handling those records. The disease burden cannot wait, and therefore we are requesting the ministry, and we hope that the committee will back us up on that, for a grace period on updating the bed capacity with the KMPDC. Should there be found a situation whereby fraud was committed, then the minister, the SHA, are at liberty to recover such monies or such funds that will be paid fraudulently. We agree to that. But in the meantime, as we wait, let our patients not suffer because of not getting admission. We find a hospital that has got 100%, maybe 300 bed capacity, but what is in the record is only 150. What happens to other patients who use those beds? That is the problem at the moment. The second issue, which also the minister rightfully put, is the issue of the UG staff, which we agree, as we stand here, that their contract ends next year, probably around May to June. They are still asking to be absorbed in permanent and pensionable. Well, we admit that you cannot be absorbed when you still have another contract. All they need is just a level of comfort, an affirmation that they'll be absorbed. And that can only be confirmed if they are funds that have been put aside or have been appropriated by Parliament on absorption of this staff. However, it is not possible to have a budget in the year 2025-2026 of funds that will be used in 2026-2027. So there should be an undertaking that this will be factored in 2026-2027, so that these UHC staff, most of them who are currently out on the streets, are not working in the hospitals and yet being paid, because some counties have not reported on those who are out in the street, which is a waste of taxpayers' money. And I agree with the CS. We need to do an audit, which is starting this week, to affirm who is in the facilities and who is not there. And if there are staff who are found to have been earning salary without providing any service, that money should be recovered, if possible, CS with interest, because that is a theft to taxpayers' money. And the last issue is on the SHA lockout of civil servants, that we are supposed to pay SHA by 9th of every month. The release of funds from the exchequer to counties, I'm not very sure about the ministries, most of the times is delayed even by 2 months, and most of the times it comes past the 9th of the month. And what happens is that whereas we miss out on the privileges of the service of SHA when we are locked out every 9th, when the money comes late, we still pay. It means we are paying for stuff without having any services. So the Committee on Health, put your heads together and recommend a way where we can be able to exempt this staff of the counties and the national government who have their share remitted past 9th, yet they still pay, but they miss out on the services that are supposed to be offered. It is not the same as the public sector, because public sector do not wait for any remittance or for any salaries. We have been lumped together, and it is a problem. I would say that SHA is somehow robbing those people without violence, because they pay late, same amount of money, and they get no service. We must have a solution to that problem, because it is our own created problem. We are the owners of the salaries, we are the owners of SHA, but these patients still go without the service that's required. I'm sure a solution can be found, and Mr. Minister, please, you have to agree me on this, or with me on this, because it even affects your own SHA as well. Thank you very much.